Genetic basis for functional hypothalamic amenorrhea. First, the definition. Functional hypothalamic amenorrhea is a reversible from gonadotropic releasing hormone deficiency commonly triggered by stressors such as excessive exercise, nutritional deficits, or psychological distress. Women vary in their susceptibility to inhibition of the reproductive axis by such stressor, but it is unknown whether this variability reflects a genetic predisposition to hypothalamic amenorrhea. Function. The classification is first, hypothalamic amenorrhea associated with weight loss. Second, hypothalamic amenorrhea exercise. Third, psychogenic or stress amenorrhea. And finally, the idiopathic amenorrhea. Application in medicine. We hypnotized that mutation in genes involved in idiopathic hypogonadotropic hypogonadism, a congenital from GnRH deficiency, are associated with hypothalamic amenorrhea. We found genetic defects in several patients with hypothalamic amenorrhea. The affected genes play fundamental roles in GnRH ontogeny and function. This protein encodes the unique receptor that is activated by gonadotropic releasing hormone 1 in the pituitary gland. These proteins are critical for the migration of GnRH secreting neurons 34 and 35, and this protein controls the fate specification, migration, and survival of GnRH secreting neurons. Genetic defects within pathways controlling appetite or stress response system might also contribute to hypothalamic amenorrhea. The pros: trying to get a body perfectionist through exercise and weight loss. The disruption of reproductive function could be interpreted as protection mechanisms, which would avoid exposure a possible high-risk pregnancy in this immunocompromised and psychologically vulnerable women. Another video about the causes of missed periods but not pregnant is amenorrhea.
My name is Nicole and I write for the website healthybalancediet.org. Cause of missed periods but not pregnant. Missed periods are medically known as amenorrhea. It's the absence of menstruation. We might right away think that it is due to pregnancy. Although this may be true in most cases, still there are other reasons why some women experience missed periods even if they are not pregnant. Adolescence. It is normal for girls in their adolescent stage to experience missed periods, but there should be concern that it is experienced with severe cramps, irritability, and mood swings. Health experts advise girls to keep track of their monthly periods and take note of heavy bleeding or pain or anything that they find unusual. Medications. Medications such as birth control pills, patches, rings, shots, and intrauterine devices affect menstruation. Using steroids and blood thinners can also attribute to missed periods. If you happen to have just recently stopped but still experience missed periods, you will have to wait as the medications may still be found in your system. Stress and changes in weight. In women, a manifestation of severe stress can cause missed periods because it can cause rise and fall of the hormonal balance in the body, thus directly affecting menstruation. A sudden change in weight may also cause missed periods. Polycystic ovary syndrome. This condition happens when there is excessive production of the hormones estrogen and androgen, which rather should be estrogen and progesterone, which are hormones necessary for ovulation to happen. It causes sacs filled with fluid to build up on and in the ovaries. This syndrome is commonly characterized by heavy menstruation, obesity, acne, and infertility. For more on healthy diet,
Symptoms are amenorrhea can occur after spinal cord injury due to temporary cessation of ovarian cycles. Osteopenia with is fractures present in this syndrome. As important as that, hypoestrogenism is also one the cardiovascular factor risk. Variability and type of irregularity of menstrual cycle observed in competitive athletes is a demonstratory example. On the other hand, hypoestrogenism and hypoandrogenism is this woman affects negatively the general metabolism and particularly the osteocalcic system. A video about eating disorders called functional amenorrhea.
Distinguished future physicians, welcome to Stop on Step 1, the only free video series that helps you study more efficiently by focusing on the highest yield material. This is the 5th video in the psychiatry section, and we're going to cover the eating disorders, bulimia, anorexia nervosa, and binge eating disorder. Eating disorders are abnormal behaviors involving food and are due to psychiatric conditions. There are many causes of abnormal eating habits, but if the situation is better explained by another medical problem, it is not classified as an eating disorder. For example, a depressed patient who loses their appetite has an abnormal level of food intake, but does not necessarily have an eating disorder. Our discussion will focus on anorexia nervosa and bulimia nervosa, which have many similarities. In both cases, patients are preoccupied with food, their physical appearance, and how much they weigh. They may have low self-esteem due to their distorted self-image. These disorders are significantly more common in men than females. Both disorders primarily focuses on SSRI and antidepressants and various types of psychotherapy. There's a significant amount of overlap between the presentation of bulimia and anorexia nervosa. The key distinguishing factor is the patient's BMI, which is very low in anorexia nervosa and normal or even mildly elevated in bulimia. Despite popular bulimia, do not use the presence of hurting activities alone to distinguish the two. Patients with anorexia can use things like laxatives and intentional vomiting, just like bulimia patients. Also use activities. Patients feel out of control during a drinking episode. Their BMI tends to be within a normal limit or even slightly high, contributing to their feelings of loss of control. Although this warning is evaded by some, current guidelines suggest not using bupropion, also known as Wellbutrin, which is a type of antidepressant. Show up on step 1. It has similar binging behavior to bulimia, but there is no purging and patients don't necessarily have body image issues. There are a couple.
Well, issued athlete in Ecuador. The mainstay of treatment in women without gestational desire is therapy hormone to avoid the causes of hypoestrogenism, particularly prevention of osteoporosis, as well as deterioration of other organs and tissues, without forgetting never give specific treatment according to etiology. The first goal of treatment is to restore normal body weight and eating habits, and it should be addressed by a multidisciplinary team that includes nurses, doctors, and nutritionists or dietitian and mental health professionals. Intervention to mitigate bone loss. Video about evaluation and treatment of secondary amenorrhea.
I'm going to talk today about the evaluation of treatment of secondary amenorrhea. Normal menstrual function depends on the interaction of two systems, the endocrine system and the urogenital tract. Normally there's a feedback loop between the brain, in particular the area called the hypothalamus, pituitary gland, and the ovaries. The brain sends out pulses of GnRH, gonadotropin releasing hormone. Depending on the frequency and the amplitude of the pulses, the pituitary.
The conclusion is functional hypothalamic amenorrhea, generally related with psychism, stress, and malnutrition is a complex syndrome in which the central and peripheral adaptive hormonal response are mainly important in these women, which are affected of a kind of nutritive and general metabolic compromise. Analyzing this complex process, we consider that the hypothalamic amenorrhea is obviously a less vital phenomenon. The last video about repairing metabolic damage, amenorrhea, and hormone as an athlete or fitness enthusiast.